of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
You want to stay standing and do the short moment? Short moment or?
Yeah, let's do that for Lori. Thank you. Thanks for the reminder.
Well, I didn't want you to have to try to get up again, Jim, and listen to you moan and everything else beyond the tape. And
Come on.
That's not what you're doing to you, you know?
That's how it's got to be.
Okay, well, welcome to the last Health Committee meeting this year. Need a motion for approval of minutes?
So,
I have a couple things in the minutes.
Go ahead.
The various motions there where there was no legislator house here at that meeting. I think you may have thought it was legislator Klein, but I'm not sure. Just to be honest.
Sorry, he's bigger than I am.
I can see the confusion there.
Yeah.
Well, you probably sat in your chair or something.
Could be. Any other discussion? All in favor?
Aye.
Opposed? Motion carries. You're up.
So HE1 is a resolution to authorize a budget modification to increase the fund to $90,500 in the preschool other supplies and expense line, and increase the state aid line by $53,847. The remainder of the funds will be offset by unused funds in the preschool division, and there will be no change to local share. This is due to a late claims commission in 22 fiscal year payment. It's a school that never really billed us, and now they are billing us for administration costs, which they are allowed to do, just so you know. And then we did reflect these changes in the 24 budget to be reimbursed for all 9 school districts.
Okay.
It's the end of the year, shifting funds.
I'll make a motion.
Take motion. Any discussion on that?
Yeah, there's no, excuse me.
Go ahead. You go first.
There's no time limit then on being able to claim for that payment.
This one's a little odd. It's not every year. It is.
It's generally the districts will claim within the same year that they receive permission to claim. They receive permission to claim in October, and they all pretty much usually claim that quickly. But last year we had a late submission that didn't come in until after the new year had started. So that came out of this year's budget.
Okay.
And then this year we had a new school district that has never claimed.
Okay, so if for some reason we did something to not pay it, it's still gonna get paid, it'll just come from somewhere else.
Right. So then we're just shifting money within that same department.
Okay.
Right.
We don't close out our books on this then.
No. No, we just added the extra funds to the 24 budget, which we already did.
Just a quick question, is there more children participating?
From 22 to 23, it's about the same number of children. I don't think there's
Yeah,
been
I'm
a
not sure
huge
for
amount of
preschool.
children. I think it's around the same every year.
Yeah, if you get a chance, you do, you put that at the top of your list. But,
Sure.
I mean, not for nothing, we're still losing population like crazy, so.
It wasn't significant enough but I can give you those exact numbers.
Okay.
From 22 to 23.
Right
Is
through
that what
the
you're thinking?
layers.
Anything else? Favor?
Aye.
Opposed? Motion carries.
HE2 is a resolution authorizing a budgetary modification to transfer $718.81 from the Insurance Recovery Fund into the Capital Project 134 This is funds received for the claim of the theft incident that happened on Silk Road in 2022. The original insurance claim that we received at the beginning of 23, that was to repair the damaged fence, and now we're just replacing the items.
I'll make a motion.
All right, got a second? Second, discussion? Everyone's aware of what this was and what happened? Very good. All right, all in favor?
Aye.
Opposed? Motion carries.
Thank you. And 8G3 is a resolution authorizing the increase of the vaccine administration fee. We are requesting an increased rate from $20 to $25 for the vaccine and from $10 to $15 for any subsequent vaccine that's administered. The last increase was in 12.
Okay, motion.
I'll second.
Any questions?
Paying the 20 to 25, is that us or
Insurance companies
insurance company?
is correct.
You mentioned in here, it says you're unknown how private insurance revenue will be affected. So you're not sure how a private insurance carrier is going to deal with this.
Because they pay us what they
Whatever's
want to
on
pay
the
for.
contract.
Right.
Yeah, okay.
We could raise it a whole lot, but they're gonna pay what.
What they want
Whatever's on
anyway.
it. Yeah, exactly.
Okay.
Thank you.
Opposed? Okay.
The next is Professional Advisory Committee, our PAC, that was in June of 23. The meeting minutes, I need approval for these. We did receive them at the November meeting, but I never requested approval, so I apologize for that. So you received them again. If you have any questions or comments.
I'm still reading my.
Okay.
So move. Second.
Any discussion other than Frank is still reading his?
Just slow.
All in favor?
Aye.
Opposed? Thank you.
Okay. I'm gonna pass these around now. Just a little packet. You'll have the overdose data in here, you'll have the environmental data in here, and you'll also have the draft rabies clinic for 2024 schedule. And that's for you to review, if you have any suggestions, or if I need to make changes. If I could get those by,
2025?
no,
Oh,
Boy,
January before I have to submit for the February.
January? By January?
I think, when do we have to submit by for January? Like the 15th, I believe everything needs to be submitted for the February board.
Did we work out the administrative problems with the overdose numbers? Did you get that straightened out? Are these solid numbers now?
They are solid numbers. You'll see that there was one error that was fixed.
Our fatalities so far this year are 15.
That's correct. Some might trickle in, because sometimes that does happen based on death certificate data. And usually there's a 1 or 2 month lag.
Oh, I'm sorry, it's 18, but last month was 15. So we have
Correct.
18 deaths so far this
Right.
year. Okay, thank you.
You're welcome. Okay. So Cortland County did share with us their accreditation documentation for reference, which was wonderful. We have a great relationship with Cortland County. So we are utilizing some of their information and how they went forward with their accreditation process to help us ready us. We are in the end stages of getting our final touches on our readiness assessment, and that will be completed and submitted after the first of the year. And they will tell us if we're ready for accreditation, which we are, to go for accreditation, or if we should do pathways. But we're already really confident that we will be ready for accreditation. Our public health education and emergency preparedness. We did presentations for vaping at Oswego Middle School and Central Square High School, emotional wellness at Oswego High School, chronic disease self-management, peer leader training. I had 2 staff that completed that training, so we will be setting up those classes. And they are working on developing the overdose fatality review team. Emergency preparedness, we updated our pandemic plan to cover all respiratory infections, not just the flu. Our overdose to action, I did hand out the overdose data for your review. Our epidemiologist attended a conference in Connecticut last week, November 29th through the 1st. And that was the first Northeast conference that has been held since COVID, actually. There were hundreds of presenters and a lot of posters. It was a great opportunity for networking. We submitted an abstract that was accepted, and we presented on establishing a phone bank during the COVID-19 pandemic response with a forward focus on lessons learned. We had about 40 people that attended our class, and they asked several questions, so it was pretty great. Environmental, I did hand out that data sheet also for your review. Preventive, communicable disease surveillance, we continue to monitor for the upcoming respiratory season. Flu season is in full swing. To date, we have 38 lab confirmed positive flu cases. Most of them are flu type A at 62% and 33% at flu type B, and 4.2 is unspecified. The biggest age group that we're seeing that has the flu is the school age children, and that's really normal during this time in the beginning of the year. And usually the lowest flu vaccine numbers. The next biggest demographic is ages 0 to 4, again, because of vaccine status. Our lead program will continue to admit new cases weekly. It's a very busy group. Immunizations, we started administering the COVID-19 vaccine on November 6th. We've given about 200 doses out. And that's between all of our clinics that we've attended and our homebound patients in our community. Flu and COVID clinics are every Monday and Friday from 9 to 11 and 1 to 3, and we're doing routine vaccinations on Tuesdays, and now we're doing appointment only. The walk-in clinics are over. It's just easier on staff, and most people you have to make appointments for things anyway, so to be more cost effective.
How many of the COVID vaccines have you given out?
About 200.
The whole group that all together with your vaccines.
That's correct. We've done about 200 COVID vaccines, and that's with going to COVID clinics and what we're doing with our homebound patients and at the health department. So it's not a huge, Them are great numbers.
Yeah, because then I think we put into like 400.
We did. So we're only ordering 100 at a time because of people just don't want it.
Yeah.
Mm-hmm.
Okay.
I got mine.
Good. And COVID is going around. We're not tracking it, but we are definitely seeing an uptick in COVID numbers. Maternal child health, we have 21 open cases right now. Our new EMR, electronic medical record, has been implemented with Patagonia Health. Our goal live date was Monday, November 27th. There is some growing pain. You could feel it in the health department, but we know that in the long run, it's definitely more efficient and more cost effective, and it will be a great system as soon as we get it totally online.
everybody understand what that is? If you don't,
Billing for immunizations, it's just growing pains because it's a new system.
we get our money back.
Yes, because billing will be more efficient. Healthy Families, Oswego County, we had our 6-month review on performance indicators. I tell you, this program is amazing. The team has received 14 out of 16 indicators, which is amazing. Our program continues to grow, and we have a capacity right now of 80%. We are fully staffed, and as soon as those staff are fully trained, we will be at 100%. Children with Special Health Care Needs, our early intervention program, they are hosting a new vision student for social work, which is wonderful. We love students. We had 41 referrals in October and 326 referrals for the year. We did hire a special education teacher, which is wonderful. We are still in the hunt for a speech pathology to fill that position. So if anybody knows a speech pathologist, send them our way. We would love to get them on board. Child Find, 28 referrals in October. Preschool special education, 45 meetings took place this month. And then children with special health care needs, we did some outreach to some of the school districts in Oswego, APW, Phoenix, Mexico, and provided information and referrals to several families for different various programs. That's all I have.
Good. So I'd like to call your attention to the rabies clinics. This year, we had a request from the city of Fulton, the number of people that had stated that they cannot make it to the other clinics due to transportation. And the city of Fulton gave up the arena and got all on board with this, with municipal employees, handling traffic, everything. So,
Jim, this says Fulton Community Center.
yeah, I don't know why they call it the community center.
That's not, are you talking about the War Memorial?
Yeah, well, they're talking about the ice rink more
The
than,
ice rink.
Next
Next
door,
door
they
to
play
it.
hockey.
I just, if you put that down as the Fulton Community Center, people are gonna go to the municipal building, because that's what that community room is.
So what should I call it?
You better check with somebody that's at the administration, Fulton, what do you wanna call it?
I think this
The ice
came
rink.
from Fulton.
You know.
Isn't the ice rink owned by the minor hockey?
Well, see, that's what I used to think, but supposedly it's in the budget now for them to pay for that, so I've gotta find that out at tonight's meeting, because I thought that it was managed by them out of Syracuse. But now, if it's in the ice rink, it's a different place than the community center,
Well,
right?
then just call it the ice rink. Everybody knows.
And they said they were gonna help with the advertising.
Yeah, they're gonna be doing the advertising.
Okay, well, I just, if I put it out there, it's, or Davey put it out there, like you put it out there, it's,
Right.
community center,
We know
everybody's
exactly
gonna be there
downtown.
with their dogs, and
Yeah.
people are gonna say, what are you doing here?
Jim, I'd like to request that we move the last Scribble one back to Minetto with the town of Oswego. It's the same problem that you have in Fulton, the same problem that you have over there. People have difficulty getting there. And
Yeah,
it is across the river. We did it 2 years ago, and now we switched it back to Scriba for this year. I'd like to see I'd like to see that a permanent rotation, either the town of Oswego or the town of Minetto, in the mix with that second Scriba.
Well, we also swapped Hannibal and Granby.
Well,
That's still,
that's still there.
that's still,
That's still
this,
playing.
Yeah.
yeah, this is Hannibal's year.
Right, that's what I mean.
You got 22 towns and 2 cities, basically, and 8 events, so it's like a 3-year rotation
Yeah,
to everybody.
and this came up kind of as a trial. This is not a commitment to Fulton going forward. It's gonna be based on the numbers.
Right.
And if it works, The good news and or bad news, depending on which way you look at it, is we may, as the city of Oswego, for the same reason, that there's people that don't have transportation to get to other areas.
So my question would be, if you don't mind.
Yeah,
sorry,
no, throw it in there.
Okay. Would we do that on a rotation like we are with the other? Do
You
we
gotta see-
keep it at 8? Is 8
See what
like
your numbers are.
our number? Because I don't think, and no more people, if you're gonna get your pet vaccinated, I mean, the numbers are the numbers for the year, regardless of where we hold the clinic, I believe. And I think that's why we keep it at 8.
Right.
Clinic,
Have the numbers changed year to year? Are they pretty close?
yes.
They're pretty close?
Well, we did go down a little, but that's when all of any farming store offers vaccine now, so our numbers did go down a little.
Mhm.
But we truly believe that if someone's gonna get their animal vaccinated with us, I mean, that's what we're gonna get,
Mhm.
regardless of where we hold
Right. People do.
the clinic.
The clinic.
I'd also like to point out that you don't even have the city of Fulton on here as having a rabies incident. Right?
Well, they had
Yes,
one on
if you look at the,
I'm looking at
on
all
the
the
other-
towns.
mark on the other sheet, the other sheet,
Yeah, this,
the back.
this map,
No.
this map
not the map.
shows us that.
Below the pie chart, there's a pie
Yeah,
chart.
below the chart shows we had so many reports, but only one.
Oh, I see, I missed it, that was my spot. I missed it. I see.
But I think the thought process that people had was, does this reach out to people that don't get their animals vaccinated because they don't have the capability to get to another place to do it? So it's a shot in the dark. I think, the city requested it, they committed to supporting it, advertising it, getting it put in place. So I think we need to do it, and then this committee needs to sit down with Vera and look at the numbers and try to figure out what the next step is. And, there's not a problem, I don't have an issue at all with trading off locations. I think the reason Scribe has kind of traditionally been beginning and end is they have very strong numbers.
And it's big, and it's easy.
It's easy to get in, easy to get out.
It's the access.
So, but definitely something the committee could look at, but, let's try this one time. Let's see where it goes, and if it doesn't have the results, then we need to look at other alternatives.
Well, I'm all for the Fulton issue, but I would, again, urge that Manetto and Oswego be included in the mix. We're doing 2 in Scribe every year. We did 2 last year in Scribe. Year before that, we got Manetto into the mix, and they were very excited about it, happy about it. And
Let's,
the firehouse worked out very well.
let's look at the numbers, Vera, for what Manetto did.
Another thing we probably should track, if we're just gonna, is where these people are coming from to get those vaccines at the locations, because you might say Manetto, but they may be all coming from Oswego, they may be coming
Well,
from Scribe.
There are a lot of incidents in Oswego, Granby,
Yeah.
Manetto. That whole area is inundated with rabies, generally speaking. I mean, I know we've had 3 incidents on my farm alone. That's why I'm always, we have them all on the other side of the river all the time. Scribe is on the other side of the river. Let's get over on the west side of the river.
That's a wall at Hastings. Stop.
I would love for that.
I only had 82.
Fulton's not that far away.
Hastings only had 82. They were up
You
to
would like to
400.
know.
Doesn't Hastings trade off?
Yeah, I think
Doesn't
that's.
Hastings trade off with somebody?
West Monroe.
West Monroe, okay.
West Monroe, Hastings.
Well, and again, regardless of where they're coming from or where they're going or where it's done, they should spread them out so that, because there are people in certain areas, just like in Fulton, that aren't going to go unless it's right next door to them. It's somewhere very
They
convenient.
may not even go across the river.
Right, well, that's
I
exactly the point.
what I'm saying, they may not go across the river because
Yeah.
they can't get an Uber to, drive them over there with their vet cut. That's the only issue, I mean, I thought when you said community center, I said, okay, that's gonna be, in the center, right in the center of town, where the people that don't have transportation are able to walk to it. It's not that far, but that's up to the city and it's up to you guys.
We'll take a look at that as a committee,
So I'm gonna send an email
Yes.
with information about the numbers that we've had for the last couple of years and their location. And I'm gonna see if I can pull together where people are coming from to attend these clinics.
If they have that. Yeah, maybe that's a good idea.
How would you get that data where they're coming from? Do they record that when they get their repeat shots?
Schedule an appointment. I believe we can pull it because we have address information.
They do, you get that
I'm not
information?
sure if it's in a database. I don't have dates. I'm gonna find out if I can get it. If I can get it, everyone here will get
I
that
see.
information also.
Okay.
Well, and if we don't have it, if it's not too much work, can we start tracking it moving
Right.
forward?
Or just zip code, we'll do it.
Well, no, that doesn't really
Not
help because
necessarily.
we're all in the,
Yeah.
most of us are in the Oswego or Fulton zip code.
Well, you guys are
For the greater
here.
area,
Yeah.
right, so it's a
Yeah, I
little
live in
bit,
Scribe, but I have a Oswego zip code.
Manetto has its own zip code, but it's only for the post office.
Right. All it is your mailing address.
Right.
Good?
Post office.
Okay, so we knew the conversation would take place, and that's exactly what we
That's what I wanted.
Yeah.
I'd like
Gotta
to
have
have
feedback.
Mhm.
Okay.
According to your map, where you're having most of your clinics is where there's no rabies. Maybe that's why there's no rabies there.
I was just
You've
gonna
been
say, that
holding
might
your
be.
clinics there, so
I guess it's working.
Dogs are all vaccinated.
Mostly rat babies.
See, that's when you hold the map up and say, it works.
Well, I got a ton of them, so.
Okay.
You hit on the lead paint.
We do. If we have a child that has a high lead level, we'll go to the residents and do testing.
Are we going into any of our aged communities and doing any tests or?
No, that's not a part of our lead grant. Our lead grant is for children with a high lead level.
Well, the children get it from the houses.
That's correct. So if a child comes back with a high lead level, we will go into the house and we'll do a full inspection.
is there any high lead levels in any of the water sources in this area?
In the water,
Water?
in the water,
Yeah, any of the water lines, there's no.
no, we would know.
Yeah.
We definitely do that testing and get that
I think the
information.
city tests,
Mhm.
does tests. I don't know if both of them do, right?
They do.
That's what it does.
Good? Done?
I'll make it.
Okay.
Second.
You got it.
All in favor?
Aye.
Opposed? Anybody want to stay?
Very good report.